Good morning, everyone. How's everyone doing today? Excited to learn about social and mobile? Revved up? All right, so thank you so much for joining us today for what I hope is going to be a rousing discussion on how to bring technology into the patient-provider communication and care delivery process. We have a great group of panelists here today. Starting down at the far right, we have Ben Dillon, Vice President of Geometrics. We have Stevie Cannon, Director of Nationwide Children's Hospital. In the middle, we have Susan Wolford, Medical Director of Pediatric Weight Management Center at CS Mott Children's Hospital. And then finally, we have Marcus Gordon, Vice President at Bright Whistle and co-author of the mHIMSS Roadmap. So to get started, just going to go through, again, these are our panelists, and you can see our Twitter handles there if anyone would like to follow along during the discussion. We'll also have them on the speaker's introduction slide, so if you don't get it right now, no worries. So I'm Jenny Lorello, and I am Senior Community Manager for Search Health IT's Health IT Exchange. We are an online resource for health IT leaders trying to navigate the changing landscape of health IT implementation and compliance. We released a survey earlier this spring. I'm not going to spend too much time on it, but just want to run through a couple of the highlights before we get started. The survey was of 237 qualified health IT decision makers. Respondents, 51% of respondents were from provider orgs with 500 beds or over, and 66% of respondents had either technical or financial decision-making power. So one of the most notables, I don't think it's going to be any surprise, is that physician and medical staff use of personal devices is certainly driving BYOD. We had that at 76%. Something that I thought was a little bit surprising or maybe just more discouraging was that only 48% said that they were focused on the increase of health information exchange in terms of implementing mobile. Hopefully this is something that we're going to see changing. So some of the top takeaways certainly are mHealth budgets are increasing. People are starting to see that BYOD is not going away and it's driving the bus, so mobile policy is going to be something that is going to have to be implemented along with integration of social. Healthcare orgs are certainly driven by compliance. One of our figures was 61% of respondents said that meaningful use, HIPAA, and ACOs were all impacting their decisions to implement mobile equally. Finally, e-physicians and e-patients really need to continue to be the champions. They are going to be the drivers, spurring the patient engagement and making sure that that communication loop really is solid. The doctor here is, I think it's just being a little bit facetious, but this is, I still think, a stigma that is out there in terms of safety of mobile, safety of communication through mobile and social, and that's hopefully something that we're going to be able to chat with you about today and see how you can implement it in your organizations. Okie dokie, Ben, come on up.
Thanks very much. Since we're all here, I'm assuming that you all are smartphone and tablet users, but the obligatory arm-raising exercise for the day, how many of you use those devices to surf the web on a regular basis? Okay, pretty much everyone. How many of you use them for social media as well? All right. So you're all in there, you're all experiencing this, and you're all coming to the table with your own set of expectations for what people are and aren't doing and how they go about doing it. So before we dive into some of the more specific stuff about the ways that some hospitals are actually using some of these social mobile connections, I'm going to talk just a little bit about some more general industry things, how patients and consumers are coming to us today and interfacing with healthcare systems using mobile devices. So as we all know, I mean, these are stats that we've all seen. The use of these devices is exploding. We've cleared that point where more smartphones are being sold every year than feature phones. The best predictions are sometime in the next year to 18 months that we're going to have more internet getting consumed on mobile devices than on traditional desktops and laptops. And so it is a space that's moving very, very fast. And in the last year in particular has really, we've seen huge changes in the way that consumers are accessing our organizations digitally through mobile. Now, a big piece of this is not just those phones, but it is the tablets and things like that. And this was a quote from the iPad mini launch, just looking at the sheer number of iPads being sold. Now, he's not saying that there are more iPads being sold than desktops or laptops, but, given manufacturer by manufacturer, there's an awful lot of these devices going out the door. And we're seeing many people picking up these tablets and never really going back to the desktop in a lot of ways, because what a lot of casual users need, they can get from these devices without having to go to a more expensive, heavier, bulkier device. This is something out of an infographic we put out recently. You can get the whole infographic there, the link from our blog. But this is just sort of the mobile piece of that. The infographic overall is just about patient engagement. And the one thing that, of course, jumps out is the toothbrush number, right? These days, more people are carrying a smartphone than have a toothbrush worldwide. So, I mean, this is, again, changing the way that communications happen in a lot of different ways. Now, this is translating into the way that people are out there seeking information. And this is from December of 2010 to December 2011. I can tell you from what we've observed, this trend has continued. Overall information-seeking behavior for mobile devices has grown at a huge rate, at about 75%. In healthcare, though, that rate of growth, and that's not to say that it's the single largest, because it was somewhat behind some other industries for a while there, but the rate of growth has been quite exceeding what we're seeing across all other categories. So we've seen it grow at about twice that rate, about 135% over about the last year or so, and the year before that, a similar kind of a pace. Now, we're seeing this play out on actual hospital websites as well. So we work with about 45 health systems, and we pull all their data together into a big warehouse that we can do some research and gather insights from. And so this comes from that. This is looking at the actual mobile device usage on hospital and health system websites. And our average here has really, again, grown tremendously. You look back to the beginning of 2010, it was 1 in 20 visits to the site. The beginning of 2011, it was more like 1 in 10. This ends about June or July there. It's continued to grow at about that pace. By the early part of next year, on average, we're going to see something more like 1 in 5 on average, and we certainly see individual cases where those numbers are more like 1 in 4 or even 1 in 3 visits to websites coming from mobile devices, and that's phones and tablets and all those different form factors out there. So it's an audience that we can't ignore. And so we've, for a while, been looking at this space, and this is the use case that we've been trying to address here. Sort of the person on the go, with a lot of constraints in the way that they're interacting with these devices. And, no surprise, web users have never been that patient. They're certainly not more patient on a mobile device. And so when we find that those experiences don't work on a mobile device very well, the majority of people bail almost immediately and are not likely to come back anytime soon. So the answer is that we have to build experiences on these devices that ultimately work for consumers. And building good experiences on mobile devices is all about working within the constraints of the device. And so again, we look at where we've been for a long time. We've got some screen limitations. There's a lot of challenges in the input devices that go with these things. There's often low or kind of iffy bandwidth constraints. There's a lot of things that we have to work around when we're building an experience for these devices. And so we've tended to sort of do a pared-down version of our interaction set. We'll prioritize a set of functions, the things that woman on the go is going to want to use out there, and create a much smaller list so that it's easier for her to navigate through those things that we consider to be most important. And that's the way that we've been approaching things. Now, there's some problems with that approach. Now, one problem with that approach is much more often we see our actual users looking much more like this, right? This person, I hesitate to even call this person mobile, except for the fact that they happen to be on an iPad, right? They're clearly not going anywhere. They have 2 hands. They have a much better data input interface to work with. They're probably on Wi-Fi. And so the constraints that we were building that experience around are very different for this user. We want to take advantage of all the things that this person has, even though that person on the go does not have those things. And so we want to make sure that we're optimizing the experience for whatever the device can handle, whatever it can bring to the table. We also went and looked, again, that data piece of this, at how consumers were actually using hospital websites. And so, those couple of functions that we've prioritized, to some extent they're on there, but not necessarily in the order that we thought. Careers is a very big one, not something that in a lot of cases we've necessarily prioritized as a mobile feature, that job hunting thing. And things that we thought were really going to be priorities, maps and directions, for instance, not something that people use a whole lot on our hospital's mobile websites. And the reason for that is not that it's not a need of that audience, but the phone itself comes with such better capabilities than we're ever going to deliver through the website. I mean, my phone gives me turn-by-turn voice directions. It knows where I am. So it's not something that they're coming to you in order to solve. So we need to really get a sense of how people are using these things. And in the end, it turns out the consumers use or try to interact with us from mobile devices very much in the way they have been for years through desktops and laptops to recreate that whole experience. As we start to look at the social components of this, it becomes very important as well that we have a mobile experience that really runs that full gamut. Because so much social gets consumed on mobile devices, it's incredibly important. It's incredibly important that we make sure that when we have some call to action, or we're encouraging someone to click through to our mobile properties or to our web properties, that those web properties work on mobile devices, because so many people are going to be getting them in that way. So relatively new technology set, responsive web design. So instead of sort of a standalone website that says, oh, you're on an iPhone, I'm going to give you the iPhone version, it's just a much more flexible approach that essentially queries the browser and says, okay, how much space do you have? Do you have a mouse? Do you have flash? Do you have, what do you have? And then optimizing the experience around whatever it is the device brings to the table. By way of example, and after the session, feel free to go out and play around with this, but Cone Health has a site that is responsive. So it's one site, it's one, every time you go to a page, it's the same page. And as different devices hit it, or frankly, if you just resize your browser on your PC, you can see how it adapts. It does things in very smart ways, reorders, navigation, things like that, in order to be a much more flexible presentation. These are auto-advancing, apparently. Now, one of the reasons why this becomes so important is because the mobile device sets are changing dramatically. So, in the past, we talked about phones. Now we talk about phones and tablets. And now we see, Samsung has these phones that are so large that they need professional basketball players to show them on TV, so it looks like a natural phone still, instead of someone having to hold it with two hands to make a phone call. We've got this wide range of devices. More and more cars are coming essentially with a tablet baked into the dashboard. Every major refrigerator manufacturer has an internet-connected fridge option now. And then we have like the Microsoft Surface stuff, which is sort of really trying to draw that line, or blur that line between the laptop space and the mobile tablet space. And so we're going to see more and more different form factors come out. We're going to see more and more different devices that are consuming this stuff. And ultimately, you need to make sure that you've got an experience that's going to work for all of these. Now, there's a lot of advantages to this general approach. In addition to just the user satisfaction piece, them being able to complete tasks, all those sorts of things. There's also SEO benefits, and ultimately, you have a certain future-proofing to this. You don't have to sit there and chase every new device that comes out every week and figure out how, whether or not the experience you've created ultimately works on that device, and have to create new experiences all the time to fit that. Before I pass it on, we've got a new white paper on the future of mobile. If you see me afterwards and hand me a card, or just tweet me at BennettGeo, I'll be happy to pass that along. Thank you.
Good morning. There I am. There's my Twitter handle, so please feel free to connect if we don't get a chance to answer all your questions today. I also have an obligatory arm raise, so use the other arm to get your exercise in for the day. It is no one to blame but the customer, right? Yay, we have somebody to blame. Bad news is we're all healthcare customers at some point in time. One of the stats I've read where we don't just have one mobile device, we're actually now seeing that people in America have 2.5 devices each. Who would like to admit that in their household? Great, there's your support group people there. Is what, toothbrushes? Does everybody has a toothbrush too, right? So, okay, just checking. I'm going to share a little bit about our evolution. Nationwide Children's Hospital is located in Columbus, Ohio. We are a freestanding children's hospital, the fifth largest in the country right now, an honor roll U.S. News award winner. We also do research. We have over 800 researchers, and we are the academic arm of The Ohio State University, just to give you some context of our story. The evolution really is, some of these kind of are a trip down memory lane for many of us. We spent many, many years trying to get everyone to our website. And, that was the existence of my team. How do we get eyeballs to our website in every which way possible? So we spent time developing content, not really sure, meanwhile, where this whole mobile thing was going to play out. During this time, the early 2000s, we were able to say, healthcare, it's okay to be the rear third of the herd, is what I kept saying. We're the rear third of the herd. We're evidence-based, right? We're not the typical jump out there, see if it sticks against the wall. You won't get many doctors, and you probably don't want to see a doctor that's the first to adopt many things. So very evidence-based. Let's see what the travel industry does. Let's see what the banking industry does. And maybe 10 or 12 years we'll think about it. Well, we know that's not the case these days, and so I'm very excited to be here and learn from all of you as well about all the exciting things that are happening, because the light bulb went off when this little device was introduced about 5 years ago. I think that's when my team finally went, oh, we don't need everybody to come to our site to get our information out. We need to be where the people are. And more, that was kind of the light bulb. Where are they going to be? They want this information in the palm of their hands. How do we make our content available to do that? So, that kind of set off a whole new chain of events with the web and mobile and social. Social took off as well. So for that, we were an early adopter. Being a pediatric facility, we knew that's where a lot of our patients and families were already. That mom demographic, was full force, the first ones out there. And so in 2007, 2008, we started building our social media exposure as well, and I'll share what we're doing in a little bit. But that was really when the light bulb went off for us. And today, you can see where my allegiance are so with the Samsung. Today, mobile changes everything. Within our organization, we actually ran out of IP addresses for our guest wireless network. Anybody else have that happen? Within the 5 years that we had one, we really thought it was just for our guests. This was a nice service to provide. But our physician, healthcare team, our staff, we have over 8,500 staff. Every single one of us just about had some sort of mobile device, it seems like, within the last year, and we had to rebuild our infrastructure to support our guest wireless network, which really is supporting our staff. Externally, we have about 14 social media sites. So the mobile impact, as Ben was saying, we are upwards to 25% of our traffic to our site is from some mobile device. And it's about 56 to 40-something percent, 56 being iPhone, Apple related, and the rest Android. So it's a pretty even split. So we're pretty excited about that. And we manage about 135,000 people within all of our social media channels, obviously the largest being Facebook with about 125,000. So we are very aware that mobile changes everything within social media, and how are we addressing those audience with our content and our website? It's all a matter of planning around how do they all tie together. We did the M.I. thing, starting in 2007, managed 3 different websites, and luckily within the past 18 months we're able to develop a responsive design site, which is what you'll see to the far left. We're nationwidechildren's.org if you want to play with that. We just have the iPhone and the regular site right now. We are moving towards the tablet size as well. We have a second-generation app that's both iPhone and Android capable. You'll see the tools there, and as Ben said, we started out mainly with physicians, docs, locators, services, because this was the traffic to our site back in the day from the mobile. But the next generation, in 2013, we're planning more personal options. So it's called My Children's. This app is available. It's free, obviously, for our patients and families. And we opened a new hospital. So we expanded our hospital, which is a little icon in the bottom left. And frankly, a lot of the directions and things like that, the impetus is so our staff could know where all the services are. Everything moved around so much, we had to have a tool for basically wayfinding to get us up and running. And so our next generation is really more focused on personalized for the families. And we do use QR tags throughout our marketing materials. So that was very important too. Again, another way to get them back to us, but again, being in the space they already are. So we know that healthcare is pushing patients online. that is through many things, but also meaningful use is coming to a head, as we all know. So within our organization, we're looking at ways, we're an Epic shop, to utilize the technologies we're building externally through our apps and through our website, and hopefully bridge those with the MyCharts, with the CareLink, and all of those good things that Epic, well, those things, I don't know if I'll say good things. Hopefully there's no Epic people in here. But the things, the tools that they provide us, and build those bridges where the deltas may occur. So that's happening in full force. And what's great is within our organization, we're in the middle of starting a new strategic plan process. So our strategic plan goes through 2013. And starting in 2014, we'll have a new plan. And within that, I'm very excited because we have a specific track around patient experience that there's going to be a team focused on, and technology integration. We are a HIMSS Level 6 organization, so investing in mobile and integration is a top priority for us, I'm very glad to say. And so as part of that, that bigger picture of where we need to be as an organization is around that personal health. So if we can get our in-house workings talking together, that will obviously help our patients and families and stay healthy. Because nobody sitting here wants to be a patient, right? We all want to be healthy. So part of our strategic plan and where we need to go, and obviously using mobile as a tool for that, is how do we help our kids and families stay healthy so they don't need to come to us as often. So that being said, I will turn it over to Susan. Thank you.
Good morning, and thank you for this opportunity to speak with you about the ways in which we incorporate new media, including texting and social media, into our clinical practice. Now, I know you've already answered the obligatory hand-raising question for the day, but I have another one. How many clinicians are in the audience today? So a good number. And I think it's important to think about the setting that we're going to incorporate these technologies. I work at the University of Michigan, as was said, hence the maize and blue. There we go. And I run the Pediatric Weight Management Center there. I'm a general pediatrician by training and have done some fellowship training and research. And so my interest is in weight management. And at the university, we offer this the Michigan Pediatric Outpatient Weight Evaluation and Reduction Program, which is our multidisciplinary program for adolescents. And we see kids who are above the 95th percentile for their BMI, and their family members have to come along as well. As you may notice from this slide, we offer, maybe you won't, bariatric surgery as well. So we feel that it's important to have a really intensive behavioral intervention so that those who don't need surgery won't end up getting it, and those who get it will have the best opportunities of having a successful outcome. So we wondered to ourselves, how can we impact patients in between visits? It's hard enough to get somebody to take their amoxicillin twice a day for 10 days, or the Zithromax once a day for 5 days, but how do you get them to make these ongoing sort of constant behavioral changes that are required for weight management intervention? So I've often thought it would be good if we could think about how to counteract the sort of negative impulses that they may have in between visits with more positive ideas of what they should do and their choices. And how could I, in fact, sit on their shoulder and tell them, what choice I'd like them to make? So we figured one of the ways of doing this was incorporating technology. And, there's so many things to choose from, right? So the tailoring, the text messaging, the internet, social media, smartphones, mobile monitoring. How could we use all of this? And we thought maybe we could combine some of these into a couple of interventions. And, of course, I think about everything in relation to food because of what I do. So it's sort of this smorgasbord, and we put it together into 2 courses. The first one dealing with the text messaging, and the second one dealing with social media. And we thought what we would do is to use the tailored messages, gathering data from an online survey so they could tell us things about themselves, and then the computer would tailor the messages to their baseline information, and we could use that. And then we also thought maybe we could do a social media intervention that they could use on their smartphone. We ultimately would like to incorporate mobile applications, but haven't reached that point yet. So if we start with the with the text messaging study, this is the first one we jumped into. And you'll see from the lovely modern phone there how long ago we started this. So back in 2006, we started this intervention where we sent text messages, those tailored text messages I described, to the participants of the program, 1 message a day for 3 months. And as I say, it was tailored to their individual interests. There were 20 children in the text messaging study. And the messages, as I say, were sent to them over the course of 3 months. Most of them were just text, but we also included images as well. And we found that they were very enthusiastic about getting those messages. They particularly liked the ones with images in them. And they said that these text messages helped them help making healthy choices at the forefront of their minds. Right? That's just what we hoped it would do. Now, did they make the healthy choices? We don't know yet. This was just what they told us it did for at least their thought process. And so we know that it is appealing to the adolescents to use the text or to receive the text messages from us. That was one of the big questions. Would they want text messages from their physician? And they seem to enjoy getting them from us. And I think that part of it is that these kids have a relationship with us, and they're invested in trying to lose weight, at least most of them are. But also, because they were tailored to them individually, they felt that it actually had some personal relevance. So I think that mattered. And so we thought that it was relevant to them, and it also seemed that maybe it's relevant to providers as well, because this small study, it really was just a pilot, became one of the most frequently read and downloaded articles in the journal for several months. So it seems as though providers are interested in it also. We went on to look at the content of those messages that we were sending, and we found that it really mattered what we sent them. So, for example, they would tell us, if we sent them a message that said, instead of ice cream, have frozen yogurt for a snack. Can you imagine what they said? All they could think about was ice cream. They didn't think about the frozen yogurt at all. So we had to go through and take out all of the references to the substitutions, because substitutions is a really common thing that people put in text messages. Didn't work for our population. So we had to make changes of that nature. So we think content is really important. There also needs to be a theoretical basis. We used motivational interviewing in ours, and so we were very much, could you do, or might you possibly, or could you reflect? And they just said, for goodness sake, just tell us what to do. And they wanted really directive messages. Now, I don't know, actually, which one would work. I mean, if we really sent them a message that said, you know, get up and exercise now, would they really do it? Or would they just say, oh, you're just too bossy and, you know, sort of not look at our next text message? All of these questions are out there that need to be answered. And so we know that text messaging offers some promise, and maybe it will work in certain settings, and it has worked, particularly for reminders for vaccines and things like that. But I think this highlights that there's a lot more work to be done to really optimize the effects of these interventions. So, okay, I can be on their shoulder to at least a little extent, but what more can I do? So we thought about the social media component of this. And clearly, as we all know, many of the adolescents today are using Facebook. I say today because who knows what they'll be using, you know, next year or the year after. But at the moment, many of them are using Facebook. And so we thought we'd explore the use of Facebook with our population. And so we did a qualitative study looking at parents' perspectives of using social media in the clinical setting with their patients. I have to tell you that this was so controversial. To get this through the IRB How many of you have good experiences with IRB? Don't raise your hands. Don't raise your hands. So anyway, we get along really well with our IRB. I mean, it takes a long while to get things through, but we get along well with them. But this particular study, the idea of having kids use social media was just scary to all concerned. So we thought we'd start off by seeing whether parents were equally as afraid as the university was to have us do this. And so we performed semi-structured interviews with the parents of kids in the program earlier this year. And we explored the barriers that they may have perceived, the potential benefits and the concerns they may have had. And so, this just tells us a little bit about the population that we saw. It was all mothers. We had one father, but that reflects the parents who come to the sessions. It's usually all the mums. And then mainly Caucasian, but some diversity in the group as well. So we found that as far as their perceptions of whether it would be beneficial to have an Empower Facebook group, they were all enthusiastic about it and thought it was a very good idea. They felt that it might help the kids stay connected in between visits and be able to bond with each other, and that they would gain support and maybe stay motivated between clinic visits. Important themes, and this is what really was most valuable to us, that they felt that it should be a secret group. And so the kids could go, and only those who we invited to be part of it would be part of it, and then nobody else would, none of their friends would know that they were in it. That it should be monitored. And in fact, the IRB had said to us that if we're going to do this, we had to monitor every post on the site. So we've set it up so that every time something is put on the page, it comes to our cell phones. So our research assistant and myself, we get them. And it's, you're used to being on call, so it's just like Facebook call. You just expect to see them coming in. And I guess we're looking out to see if somebody should say something like, I gained weight, I'm so depressed, I want to end it all. At least somebody would know, and you wouldn't have that out there without it being monitored. And then they suggested that we have rules to ensure that there are positive interactions, which I thought was a very good input. One parent expressed concern about the possible exposure of undesirable advertising, because as you know, on the side of any of these Facebook pages, they're the adverts, and you can't do anything about that. So we're a little worried about whether they'll get things for, I don't know, the next quick fix to weight loss, which we really don't want them to focus on. So that's one of the problems that we think we might encounter. And they all had concerns, really, nearly all of them had concerns about privacy and security related to social media in general, but not about using Facebook in this clinical setting. They were positive about that, and they felt that they had helped their children know how to deal with security issues in general. Oh, we're running ahead without me. So I guess that means my time is running out. I'll quickly go through this. It so happened that parents thought, we don't want one just for the kids, we want one ourselves. So then they said they also wanted to get support and share their thoughts with the other parents and get helpful tips from us. And they had no concerns about they themselves using it. So now we have a page for both the adolescents and a separate page for the parents. They wanted healthy tips and recipes, nutritional facts. They thought it might help if we put self-esteem boosters, things that help motivation, specific recommendations for exercise. And the themes that came through for all of the parents and for both the adolescents and the parent pages, they thought that they would help them gain support from other participants and stay motivated, which is really what we want. So now, not only will I be on their shoulders, but hopefully there can be all these other positive influences that are on their shoulders as well, helping them stay adherent to our recommendations. So I think it's important to note that there are these challenges that are involved in when using new media. So evaluation, it hasn't been tested in many places. It really needs to be done. This is automatically advancing, so I'm having to keep going back. There's limited knowledge about the components that actually make a difference. Privacy and security is an issue. Development costs are there, even though the maintenance is not so much. The development costs are quite significant for some of these things. Reimbursement for this is an issue for physicians. And there's a changing landscape because you don't know what's going to be next. And providers have to become more confident or comfortable with using it. So I think that maybe at this point, rather than actually having this fully formed idea, maybe we have just sort of the ingredients for a in the end. And hopefully, not in the not-too-distant future, we will be able to realize the full potential of new media in the clinical setting. Thank you so much for your attention.
How many people, by the way, saw today's USA Today article, Health Insurers Learn How to Woo? Who saw that today? No one. It's about how health insurers are now targeting patients. Good time. Good time. So, good morning, everyone. I'm going to, you could follow me on Twitter, Tri3, I'm a triathlete, hence the Tri3. I'm a co-author of the mHIMSS roadmap, which just launched yesterday. It's a great resource. I encourage you to take a look at it. It talks about the full gamut of patient-centered, provider-facing IT challenges, legal challenges across the entire mHealth landscape. And I'm also a feature healthcare business blogger for the Atlanta Journal-Constitution. So I'm going to talk in a little more detail about actual engagement strategies when it comes to kind of reaching patients, because we all have acknowledged that it's important to reach them, but how can we actually go ahead and do that? And really, from a provider perspective, you know, there are considerations. It's not just a marketing outreach. It really is, you know, meaningful use, stage 2 and eventually stage 3 requirements, ACO penetration, hospital 30-day readmissions, patient satisfaction. These are real business and organizational issues that providers face, and it affects their bottom line. So reaching out and becoming engaged with patients is not just, you know, the latest social media craze of the month and extending your marketing communications reach, but it has real intrinsic value. This is a nice little cartoon we developed, and it kind of talks about, you know, you have a scale, right? You have a Facebook page, or, you know, Stevie and her team at Nationwide Children has over 140,000 warm connections, so to speak, through their social media channels. That's huge, right? You just posted your 1,000th tweet. That's great news. So Mr. or Mrs. Hospital executive says, well, that's great. You know, what do we do next? What does that mean? How does that impact our organization? So actually what some of the article in today's USA Today talks about is kind of, you know, where are the current patients living, right? All those people, that providers that we're trying to reach, where do they live? You talk about your traditional marketing mechanisms, TV, radio, even some standard SEO, email marketing. But really, you know, through a lot of the sessions that have been discussed throughout this week, you know, they're in that space, right? The social, digital, and you can definitely put mobile in there. But you have looser control over those messages, right? They can't speak about you in your TV commercial, but they can certainly talk about you on your Facebook page or your Yelp review page, your Facebook wall, your Twitter. So, you know, these patients are actually, you know, in that realm. And let's talk about mobile health in that context. So, according to a Pew Research study that came out in September, 31% of cell phone owners say they use their phone to look up medical health information. That's up from 17% just 2 years ago. And of those, 37% actually use that information, caregivers use that information to look up health information. So really taking down that caregiver, that person who's looking out for someone else's health or even their own health, is even more inclined to do so in a mobile environment. So what does this mean if you're, well, let me go back one slide. So why is this important? Because caregivers are 25% more likely to follow their friends' personal health experience or updates via social networking sites such as Facebook. So, for example, if you were to go on Nationwide Children's site, they do an amazing job of leveraging, you know, and talking, you know, to their patients through social media channels. You'll see a huge amount of activity and chatter. If you go to Cleveland Clinic, Mayo Clinic, all these large organizations have very robust channels where there's a lot of conversations going on. But how do you become a part of that conversation, and what does that mean? And what does it mean specifically from a mobile context? Let's take a look at Renown Healthcare. Renown's moderately sized healthcare system out in the Reno-Sparks area. They recently went on a like campaign to acquire, you know, new fans or likes for their Facebook page. And over a 3-month period, you can see they acquired, give or take, about 12,000 folks. and 8,500 of those folks came through a mobile channel. So out of those 12,000 folks, 8,500 of those folks liked the renowned Facebook page, corporate page, through a mobile device. That's pretty significant, and I'm sure Stevie has some similar results in terms of, you know, what Nationwide sees. So what does this mean, right? You have a captured audience through a social media channel. How do you remarket, or how do you engage with them? We did at Bright Whistle some targeting. We're the only Facebook ads PMD HIPAA compliant partner in the world, so we have access to their ads API. We did some research. Partnered with Duke Raleigh Hospital and Duke Orthopedics, and using a multivariate ad testing environment, our goal is to determine the optimal way of targeting consumers for Facebook. And this was to actually go out and acquire patients through these channels for orthopedic surgeries and consults. So let's take a look at what we did. This first iteration is actually a Facebook ad that goes to a web-based landing page. So it's an ad that you would see in Facebook, and Susan talked about, you know, getting ads in Facebook, right? People are really smart at doing that. And this goes to a landing page environment that you would just go to the web. This next series is actually a paid post, which is a more engaging story, so to speak, and it goes to an internal Facebook landing page within a tab of the Duke Orthopedics. So you go from an internal environment to an external versus an internal and an internal. So what does that mean? What it means is significant ROI. Because what you're doing is you're significantly increasing, once you do that, and you go from that standard traditional display ad to a paid post, which is a story, an engagement story that people can actually become a part of the conversation, your click-through rate jumps from 0.02% to 0.62%. And your CPC, which is cost per click, goes down by over 60%. So that's significant bottom line value that you can deliver through just a nuance in marketing on Facebook, engaging with pertinent patient populations on how to bring them into your hospital system. So as a result of that, in just 2 days, we spent $40 in 48 hours. 15,000 people saw the post. We had shares, comments, likes, patient stories, and this is on the left just a synopsis of what that activity looks like. And out of that yielded 7 physician recommendations, 4 patient inquiries, and we're measuring the downstream actual net revenue from the discharge files currently. And 65% of that engagement came from mobile devices. So really, it's huge in terms of utilizing these mobile devices to penetrate, you know, pertinent target audiences through social channels. Something else I want to talk about is, you know, we talked about kind of having an app, having a mobile optimized device, responsive design, so to speak. Ben mentioned, how do you actually, then you build these types of environments, how do you bring people into them, right? Because it's great to have an app in the iOS or Android store, but if no one's actually using it, if you have a low utilization rate, then really, you know, what's the benefit to the organization, right? You want to build these apps to increase engagement, to increase, you know, allow the patient, enable the patient, their caregivers to take control of their health through these mobile devices and through the tools we've all been discussing today. So we partnered with the Atlanta Journal-Constitution in Atlanta, and this is for Atlanta Medical Center and affiliate hospitals in the Atlanta region for Tenet Healthcare. And we actually created mobile optimized, known as WAP, advertising. So if you look here, traditional click-through rate on an ad, on a standard traditional web banner ad, is about 0.04. Here, our direct response rates were significant. We had a 0.52 response rate. So we had targeted mobile display advertising, which had device recognition. So if you were on an Android and saw an ad for our app, and in the app it had, you could store your patient data, you could communicate with a physician, you had a physician finder, as well as the locations, directions. We had a significant increase in the downloads and utilizations, and I'll show you that in a minute. But if you know the device, you know, unique reader interaction, right? We talk about, you know, the MDM environment, fragmentation, segmentation, so many devices, right? iPad, iPhone, all these Android devices. How can you effectively target to each of those devices? So the week that we ran the ad, and we tested it, we actually had over 100% increase, and this is just the downloads, but we saw the utilization uptick significantly as well as a result of that. So really, you know, creating that mobile optimized targeting environment to increase the downstream engagement is effective if you do it through the appropriate channels. So in summary, driving mHealth and the patient-provider relationship, really be cognizant of amplifying engagement through relevant social channels. And these channels are not just push mechanisms, especially these social channels. They're also very viable pull mechanisms, and pull for targeting, pull for engagement, pull for meaningful use, pull to, really be proactive in communicating with your patients, not just to push out a press release or push out some information, but really incorporate strategic business objectives into that. And finally, deploy optimized targeting across your MDM ecosystem, right? Make sure that if you are going to, utilize these resources and devices for appropriate channels of communication and engagement, that you're going to support that, with effective marketing strategies that can ultimately, drive some value to the organization. So really what we've all talked about here is, we can build for this and we can build for traditional media sets, but really this is where everyone is today. Okay, even Fido has an iPad mini, it looks like. So with that said, I'll turn it over to Jenny and we'll kind of engage in some Q&A.
Okay, so does anyone have any initial questions off the bat? If not, I can definitely, I got a couple. Okay, perfect. Mr. Moore.
Hi there, John Moore, Showmark Research. So the question I have is, listening to this, I heard a lot of mobile health, but it was all about more or less marketing. It seems to me, or that's where the funding's coming from for most of these programs, except I believe yours, Susan, but that was more of a pilot. It wasn't like a broad rollout program. It was kind of a grant-funded or a research effort. So I'm wondering, from the panel, at what point are we going to get to true patient engagement, not around loyalty, not around bringing them in the door to maybe have someone look at their knee or look at their shoulder, but actually helping patients manage chronic diseases using this technology? Because I've seen plenty of pilots, but I've seen absolutely no broad rollouts at any institution.
Oh, that's a good question. I'll go first. At Nationwide Children's, you're right. The corporate is the marketing-driven brand, and how do we connect at that higher level? We are a research institute as well, so we're working with folks who have grants, who are trying to solve problems around diabetes, asthma, things like that, those early adopters and those physicians, honestly, the fellows who want to help their patient population. We are launching a diabetes calculator. It'll be the first pediatric calculator out there. I was hoping it'd be live today, but hopefully by Friday. And that's something we're going to push out that'll be available to anybody. So if you go to our endocrinology site, we have the embed code. So again, anything we build from a patient perspective, we want it to be universal. Anybody can use it that has a pediatric diabetes population. But you're right, the more patient-centric is at pilot phases throughout the organization with those key leaders who have grants or funding to help us build those.
I agree, and I think that the issue here is that funding. So that whole process of, as I showed you, the picture I showed was from 2006, right? So then you did this, I did a pilot, and then I applied for NIH funding, and I got NIH funding, and now I'm doing the randomized trial. By the time we finish working out whether the text messaging intervention works, people will be doing something else, right? So it is potentially a problem of that funding mechanism, but I do think that we have had lots of pilots before, but there are a lot of randomized trials in progress now, if you look at trials.gov, and I believe that that will then move on to the next stage, which will be implementing it in a sort of a wide-scale fashion. So it's just a matter of time.
Not from a provider perspective, because the financial incentive isn't there today, right? It's coming. It is coming, but it isn't there today. If you're a hospital executive, you're worried about today your patient volume, right? You have on the back of your mind, 30-day readmissions and your ACO model development. But if your CEO calls on you today, where are those patients? And then it's going to be where are the right patients, the quality of those patients. The payers have actually done a very good job. Aetna, Humana, Cigna with developing some of those, app-based and online tools to bring and create. Well, they do. They trust their doctor. Yeah.
So we need to expedite our pilots, get them out of pilot mode.
Yeah. Go ahead.
And the insurers, I mean, usually when you're treating obesity, we don't think very positively about insurance because it doesn't typically pay for obesity. But I would say more recently we've been contacted by a number of insurers who, one, want to pay for it, and two, want to pay for one intervention that's technology enhanced. So hopefully early next year we'll be doing a actually very large, it will again be a study, but funded by the insurers to do intervention that isn't sort of all in person, but has a lot of the new media incorporated.
I think it has to come through the provider.
Go ahead.
To dovetail on getting patients in the door and where they are. First of all, it's great. I really enjoyed it. But for those of us providers with limited resources, would you recommend that we modify our website, like you were talking, Ben, as to work on all devices across all platforms, or to spend money in maybe a Facebook campaign to get people to then come into the practice? I mean, it's kind of a catch-22, it seems.
Yeah, I think in the short term, I mean, if you're running with really tight resources, you may just have to make the decision that today you're going to try and make the most of whatever the platform that is that you have. You can go out and assess as well. Look at that on a bunch of different mobile devices. See how well it works. A lot of sites today do work fairly well on the tablets. When you get down to the phones, though, it's a much bigger shot in the dark. And then if you've gone out and if you've used Flash and other things, it becomes sometimes really, really difficult for any of those platforms to really work very effectively. So, assess kind of where you're at, whether or not it's working, and then, if it's functional, then go ahead, at this stage and focus on that other set of efforts. Longer term view, the life of a website, a web design tends to be 3-4 years. So at some point here, you're probably going to sit down and rebuild that. And when you do, just make sure that you're approaching it at that point, maybe even from a sort of a mobile first philosophy. That's sort of where we are in terms of our experience design at this point. Is we start actually now. What does the design look like for various mobile devices, and then how do we then embellish that when we actually have a larger screen, and we're sort of building it that way rather than trying to build the full experience, and then how do we pare it down? But yeah, in the short term, you have to make those judgment calls for better or for worse.
Yeah, I think where a lot of marketers fail is they sit in a very solid organization, especially when it comes to mobile related type of items, right? So they sit in there. Okay, we have to push some communication out. But how often does a marketer come to the table and say, oh, I'm going to start with a set of business objectives, and from there I'm going to develop my strategy? Does my strategy mean outreach through a mobile channel, right? Does it mean that, we need more patients in order to meet, you talk about bariatric surgery, for example, if you need to become a center of excellence, you actually have to go out and have a threshold minimum number of surgeries to get that COE, and then it affects your insurance. There's a whole financial ecosystem around that. So I think where a lot of marketers fail, but also on the flip side where some organizations are great, like Cleveland and Mayo's, they take those business objectives, put those first, and build a marketing infrastructure behind that. And I think if you take that approach, you can allocate your marketing dollars, so to speak, or resources, that most appropriately address that.
Okay, in the back.
Doug Goldstein with iConnect. The panel did a great job in terms of phasing out. Really, we're very similar in mobile where we were 12 years ago. Do I really need a website? Do you need a mobilized web experience? Yes. Do you need a mobilized app? Yes. Does it start with marketing and access to care and then move into services? Yes. So the panel did a really nice job of that, and I want to thank you. Ultimately, I just want to end to say the web is not about apps, it's about service. So if your customers are carrying internet mobile devices, how do you enable services? And that's really a multi-phase process that we all have to go through.
Yes, thank you.
I would add to that. We sometimes get a little app happy in healthcare. I hear organizations all the time where they've got an objective to create an app without, again, first starting with a business objective, where the app is a tool that might actually solve that. So, as you look at it, apps have a great role to play. There's a set of things where putting that app in place when you have a relationship with that patient, when it's something they're going to do with some regularity, if you need to access GPS on the device or things like that. In the absence of those things, though, going through it in some sort of a web-enabled way where it's much more findable, it's much more device-independent, some of those kinds of things, is a much cleaner way to go for a lot of those interactions.
Great.
Good morning. Thanks for the presentation. John Melling from Top Tier Consulting. I think, just probably going back to what John was asking earlier on about who's going to buy it. Is it going to be the insurers or is it going to be the providers? And I think there is evidence that it's the providers, but also I think increasingly health plans are seeing benefit through coordinated care and those kind of things, where they are getting more actively involved in directed care. So that's the first point that I would make. But the question that I've got is looking across the broad spectrum of what you can do with social media, whether you're just providing, whether you're providing access to content about you have this condition and therefore these are the things that you need to know is one aspect. The other aspect is actually driving care. So if you're dealing with adolescent diabetics, making sure that you're prodding them and saying, have you eaten properly over the last week? Let me see what you've eaten. Those kind of things. And there is evidence, certainly in Scotland, that providers have taken that approach with Sweet Talk and making sure that they're using text messaging appropriately to drive that patient population effectively. So I think my question for you is, in your experience, and it's probably directed to Stevie and to Dr. Wolford, in your experience, have you tested both the use of content to generally educate the patient population versus providing more direct input into their care, whether it's making sure that they attend their appointments so that you're saving money at a very practical level, or whether you're getting them to follow a more strict regime in terms of health management? What are your views on that?
Well, thank you. From a social media standpoint, we kind of do both. We started with the global level with the brand and realized one size does not fit all. Those messages, because it is personal and social, like we said, we have 14 different channels between Twitter, Facebook, LinkedIn, you name it. And within Facebook specifically, we have groups. We have a process, so people have to apply within the hospital. Why do you want your own social media page? What would you use it for? Who would manage it? I love how you said, you're on call. It's Facebook time, Facebook on call. I'm going to start using that. And so we have kind of both, where we give general messages within those channels. So one of our channels is sports med specific. And we give tips for the kids, especially during, right now basketball season, so that anybody following, here's some things to do, some coaches, here's some tips. But we also promote our health education classes through there that's specifically directed towards them. We don't go to the point where it's one-on-one, hey, Susie, I see you have an appointment next week. But we do try to direct, both from a health literacy, explaining some things there, and promoting, education overall through those kind of specific sports med. Like I said, diabetes, 22q is another one where we dissect our audience so that we can have more of those conversations with them specifically in that channel. But they're open channels in our case.
So within the weight management program, as far as providing just content and, as we say, not just, but content and information, we did that on a website. We didn't have a lot of success with getting our adolescents to go there. I think it may be a limitation of the website itself, but also that adolescents tend not to do that as much. From a standpoint of actually impacting that behavioral change, the Sweet Talk study was a great one and was out, and was what we used as one of the information or background for ours, and it provided with a lot of useful information. One of the things being that after a while, they stop turning it on. I mean, they know that you're going to text them and say, take your blood sugar, and they don't want to hear it anymore. And that's one of the problems with many of these interventions, is how do you keep it relevant for the specific patient. And so we've found that to impact behavior change, we think that the tailoring process and the depth of that tailoring is really important. And also keeping adolescents involved in your development. So really, at least if that's the population you're trying to reach, because they know what they will find engaging much more than I would. And in fact, we, in one of our focus groups testing this, we had up our text messages and we asked them, what they thought. And one of their comments was, "Oh, it's like England in the 1950s. I thought, oh dear. So we had to change that, those particular ones that they found boring. And we changed them with their input so that it would have more impact in the actual intervention. So I think that there are definitely ways to impact behavior using these technologies. Again, they're only really being done in studies and not having been rolled out sort of on a wide basis, but will be soon.
I'd add to that. There's a great book called Joe Public Doesn't Care About Your Hospital, and it sort of laying out the case that marketers should stop talking about the hospital and start talking with patients and consumers about the things they actually care about. And so I'm seeing the beginnings of a movement for the marketing in a hospital to be much more around educating patients and that whole piece of things. From that perspective, though, marketers are going to have to get much more closely tied with the clinical folks in the organization, the operational folks in the organization, and so in a lot of organizations, it's still very much a silo that doesn't interact with large parts of the rest of the organization. I think they can't get to where they need to be, and particularly given the shifts with ACOs and all those sorts of things, what they're going to have to do in the future, without sort of breaking down some of those walls and getting a little more involved. They have an expertise that I think is useful in a lot of these other conversations, but doesn't necessarily get included until sort of after the fact.
Perfect.
Thanks. My name is Ayodele Ko. I'm with SMS Streamer. We're a mobile solutions providers for healthcare space. Thanks for the presentation and for the message that we so dearly preach. You guys have been doing a great job reinforcing that. My question is around the manufacturers, the actual drug maker. Where do you see them in this space? So we've heard a lot about the insurer, the providers, the patient, right? Do you potentially see some of these players as players who could help you roll out these offerings on a larger scale, who could actually pay for it because they could potentially have some financial incentive there? Where do you see them?
They could definitely pay for it.
Good morning. Great panel discussion. I have a quick question. I'm a specialist, and of course, we're always looking for referrals. So what strategies are being employed to improve peer-to-peer engagement to garner those referrals? So more of a B2B approach. And my second question is, what are you guys doing to pull data? Gary Vaynerchuk, the author of the Thank You Economy, talks about pulling data rather than pushing. So what strategies are you employing to pull that data?
Yes, Mr. Tippett talked this morning about Verizon's capabilities to pull data and call the data. So really because of HIPAA, it's very limited from a provider standpoint. We'd have to opt patients in, and Susan can probably talk the best of pulling in that data. When you talk about peer-to-peer networking, physician referral networks, obviously with reform and with a lot of physician practices now being rolled up into big hospital systems, and especially in the bigger markets, and then in some of the smaller markets you have physicians perhaps like yourself who have your own practice and are looking, your livelihood depends on your referral network. There are a lot of apps out there and tools and resources. Sermo, I believe, Ben, is that right, is one of them, where you can tie into your peer-to-peer network. SERMO. Yep. And in terms of, I would encourage you as well that a lot of the directory review sites, Yelp and Foursquare and Google Places, make sure that those are all current. Because when people, the way that Google is changing or currently working their algorithms, and Bing soon too as well, and Foursquare, is that it's not just if you key in a search word, but it's your search history, it's your location, it's the presence of your sites. It's not just the search engine optimization and the keyword taxonomy that you build into your site. So make sure that all those sites are up to date, because more than likely within the first page you Googled, your Yelp review or your physical address will pop up versus your typical website first. So when you talk about peer-to-peer type of stuff, those are just some tricks of the trade.
Just to be clear, in terms of pulling data, I wasn't talking about our data, I was talking about social media data. So the things that you're finding on Facebook about patients, how are you leveraging that data in order to make good marketing decisions?
The data we pull is really, like you said, the demographic and who's engaging, their actions, who's taking actions on which content we post, so we can better tailor that content to drive engagement, to get them, more involved with us at whatever level they're comfortable doing that. From peer-to-peer, to your point, if you're credentialed with a hospital, we do a lot of outreach, and we have a physician liaison program, so get to know them well. They'll take you on the road. But we also do a lot to promote our specialists through the website, like they were saying. So, we have customized URLs that you can do. So I'm sure the team within the hospital, if you are affiliated with one, so standalone is absolutely go with what Marcus said, and your listing is your credibility out there. So if you have good reviews and even a picture that speaks 1,000 words. People want to know who they're calling to take care. So perception is reality. What is your online perception? That may help your.
Yeah, and also I haven't seen anyone pulling large volumes of data except for sort of sentiment tracking kinds of stuff. But there are a lot of customer service opportunities that pop up out there. I mean, patients go out there and they put on Facebook, they put on Twitter, their life history of, or whatever they're dealing with today, things like that. And so there are opportunities, if you've got a good listening program in place, to essentially identify those and intervene. Actually, Marcus is at a former hospital, had a great one where a family member of a patient was tweeting about the hospital experience and was able to sort of intervene and get a much better experience for that family out of the deal. And so there are opportunities out there, but in terms of sort of scaling referral, I've not seen some of the social technologies at this point used in quite that way.
Thanks. Thanks for the presentation, guys. Very interesting. My name is Jesse Williamson. I'm with WeMultiply. Very interested in the prior question, actually, specifically with regards to social listening. One of our portfolio companies is making a big bet on social listening. I'd love to hear from you guys where you see the future of that space going, maybe building upon your last response, which I thought was interesting as well. Thanks.
Thank you. I think for Nationwide Children's, we've had a listening tool. We started with Hootsuite, did all the free stuff we could until the audience got too big. We use Engage 1-to-1 right now to monitor our channels, have some tools to do sentiment, but we also have a live body dedicated to making sure we respond to every customer service question out there and troubleshoot. And as far as listening, that is absolutely, it's customer service. It's one-to-one customer service. So, that's what we take back to our executive team is, this isn't just, what'd you have for breakfast today or, kind of social chit-chat. This is real customer service. They have issues. They're contacting us. So we can drive patient experience and hopefully referrals as well down the road. So we absolutely listen and I think work very closely with our in-house people so that we know, as Ben said, Marcus had experience at his hospital where people are, our current customers, but we're also trying to listen to our potential customers as well. And those are very different messages that you have to craft and be social, be real, be human.
And I think, too, it's important to, position that in the context of business objectives and business initiatives. It's not just, social, latest flavor of the month. Why would Mr. CEO or Mr. COO care if you're listening to conversations, right? Maybe you've had a patient intervention, you've intercepted a patient complaint, but let's say it comes down to 30-day readmissions, right? Someone actually posted on your website that their grandma is not doing well and they came into the hospital 15 days ago, right? So you don't want them to come back, another 4 or 5 days later. They fall within that 30-day window. So it really does, these tools and resources are valuable when you talk about, the overarching business initiatives and with reform and accountable care organization development. It's not just about pushing out information, because listening really reflects the tone of the organization and really helps sets a trend within the organization that you're going to care the best that you can for each patient / customer, because it potentially could make a difference in impacting, the way that you deliver care and the way that they receive care.
And It's a tricky problem within healthcare as well, because we've got a number of things within that listening context. It's a little different than every other industry. You know, if you were listening to Harry Griesbann's presentation earlier, he was talking about the fact that the health grades information on him is wackily wrong. I mean, just out of control wrong. And so, you know, we've got all those directory sites that you need to monitor, and, you know, even if you're actively engaged in that and you go out and you correct these things, you know, 2 weeks later Google can turn around and you know, mess up your phone number again and some of those kinds of things. All the reviews that go along with that. And there's a number of places that we need to keep an eye on that very often, you know, your typical consumer brands don't. So there are a couple of companies that are starting to build out tool sets to help address some of that. Bright Whistle has got some pieces that help to do some pieces of that. There's a couple other companies out there as well that are starting to do some things tailoring that sort of listening capability to this market.
Can I jump in? Actually, I have more of a comment than a question. A little background about me. I'm Alex. I'm not medical related at all, but I'm pretty tech savvy. I developed for Facebook. I'm pretty into the whole social media scene. My partner is about 70, not as much into the social media and tech scene as I am. Very medically related, but not tech savvy. One of the themes I've heard kind of at this conference is this whole social media, this listening, and what do we really do with it? And I actually had a conversation with one of my friends out in Silicon Valley out in California the other day, yesterday, about this kind of theme. And he essentially told me, you know, Alex, we have people ready, sitting, waiting for people like everyone here to contact us and say, hey, we want to design something so we can better tailor it. Because when you guys tailor something for your clients, it also helps these large social media sites tailor the content and tailor their clients as well. So they're really, really waiting for you guys to just reach out to them. You had mentioned something about certain advertising, you know, on Facebook. That's a completely controllable thing with your groups. If you were to send a quick message, and I can give you a contact, they'll be able to say, control exactly what ads pop up every certain time. Not only that, but you can control, say what ads you want to pop up with certain user logs in or a certain group logs in. So these social media sites is kind of the same thing. I feel that both the medical field and this field, they're kind of at different ends of the spectrum, but they're both waiting for each other to kind of come together in the middle. And I think there really needs to be an embracement of that.
I agree wholeheartedly. I think one of the things that those of us who are doing research in this field in healthcare really feel the limitations that we have. I mean, working with other academics who are very interested in health means that we typically get the behavioral components and the health components correct, and the technology we know we're sort of light years behind. Coming to this conference has always highlighted that for me, that there's so many things happening in the technology world and they're not really coming in contact with the research world. And so one of my initiatives is to try to bring the two together. So, for example, at the Obesity Society, we've started an mHealth, eHealth section with the hope of bringing both groups together. And at the university, hopefully we'll be getting a grant, hopefully, fingers crossed, starting in January, to do just that. Because I think it will really help move the field further, move the field forward much, much faster than with us all staying in our silos as we are at the moment. So thank you for raising that point. I think it's a fantastic one.
Yeah, I'd say as well, you know, the financing component tends to be the hard part, and getting operational change to happen around this so that you are actually incorporating this into the care experience, that tends to be very, very difficult. Building the tools tends not to be nearly so hard as getting the way that care gets delivered changed in order to really, you know, at scale to get those things incorporated.
Well, sorry to hog the microphone, but that's something I've seen is that this technology here is great, don't get me wrong, but it's really not the technology that's going to change, it's the infrastructure, it's the procedure that goes with the technology that's really going to change. And that's really so far what I've seen is lacking. We have a pilot program in New York City with roughly 1,000 to 1,500 people right now. And the technology it's not groundbreaking at all. We've taken bits and pieces from existing technology and created something new. But really what we've done is showed them how to use it, showed them exactly step by step, very simple, what the procedure is. And by doing that, it's really changed their whole view on the health care that they're receiving and what they're doing with it and what they're, changing their mentality about what they're going to do after they're done with it. So I think you're absolutely right. It's the procedure, not the technology.
I agree. I was listening this morning to a group breakfast session, and they were saying basically utilization breeds innovation. Put the technology in more hands, and you'll get more ideas. And then, that ball that we're rolling uphill for change will maybe go a little faster if we can distribute it to more folks.
So I think that it's all of the above. So, for example, we wanted to build a website, an interactive website for patients with coarctation of the aorta to use to learn about, because they are at increased risk of developing obesity. We wanted to do something specifically for them. We wanted it to be very interactive, very engaging, and we wanted to use a university group to develop it. We were met with barriers at every point, and what they told us they could do, we knew that no adolescent would go to it. We went outside, we found someone who develops websites very easy. It was like, this will be no problem, we can do it overnight, we can do it at low cost. It was night and day. So I think one is the infrastructure is definitely there, an issue, but there's also an issue of having those who know how to use this technology very easily and can manipulate it well, and putting the two in connection.
And just one more comment on that. Sorry, you're standing there for a while. I think, kind of to your point, my team was able to go outside of the organization and get resources to do a lot, given the mobile space and the web space to develop that. But it's going to come full circle. We have to integrate back in-house with whatever mainframe, system there is to try to get data out so that it's valuable moving forward. So everything we were able to do kind of in a parallel space is going to have to be worked back in so that it has, meaningful value to all of our patients and families moving forward. So that'll be the culture change right there.
Okay, so we're officially out of time, but we'll do one more question, and then the panelists will be up here for a couple minutes to answer anything. And also, please note the shameless plug to join us tonight at the Tweet and Meet.
Thanks for the last question. Mark Fries from Wellview. I certainly have an appreciation for this concept of the first stage of mHealth being customer acquisition and the marketing side of that. As it relates to patient-provider interaction, are you seeing your organizations or your clients developing tools for the provider specifically to provide education or engagement tools directly to patients? So it's not sort of institution-to-patient communication, but that direct provider-to-patient interaction. How do you see that evolving over the next couple of years?
For us, that is our next phase. Our app, like I said, was mainly around wayfinding. We did the mobile site first, but the app second. And our next phase, since we are pediatric, is our primary care docs have asked us, do you have a tool we can pull up our own app and give those guidelines? So when I'm at the 3-month well baby check, here's some things you need to know, here's some questions you need to ask, and really getting those American Pediatric guidelines out there in the hands of families so that they can have those tools at their use 24/7, but it's also our primary care docs, in addition to the piece of paper that the family will lose in 10 minutes, what other tools can we provide them that's echoing, their standard of care, but also, gives the family some resources ongoing. So for us, that's our next step, is getting that kind of that well check, program into our app so that it's a little more one-on-one, but it also allow them to ask, build that list of questions, because I don't know about you guys, but any new parents, at least the first time around, you care about, every little thing. And so, what kind of tools can we build within that app so that those questions are there and even could be perhaps emailed beforehand so that you know exactly where this family's needs are and address those first before just giving the rundown of the laundry list of things that your child should be doing at every milestone. So that's where we're headed, to try to involve the physicians within our own institution. We have about 1,000 docs on medical staff, but most of those are primary care out in the field. So we need to give them, like you said, tools to help families. But to the discussion earlier, we would like to be the ones providing those tools to meet standard of care.
Yeah, I think I definitely resonate with your thoughts. I think that is the next step. I think there are some barriers to that. However, you talk about interoperability and just the plethora of devices that are out there from a resource and constraint standpoint. How do you, for example, develop some sort of mobile optimized or app-based or responsive web type environment that can actually deliver that information, that is communicated effectively, across all those devices, right? But it's also easy for the physician to use, and it's also easy for the family to use. So when you talk about, there's a difference between talking about, let's say, a pediatric environment, right, where you might find, a family that's young, and certainly the parents are probably tech savvy, or at least somewhat tech savvy, versus a geriatric environment, where perhaps you have an older physician and also older patients. Maybe they don't have a caregiver who has, easy access to a device or a tablet. So, as the ecosystem evolves around kind of, NDM, which has been a big buzzword here, mobile device management, as that tightens up a little bit, I think you'll see these programs start to roll out. But for essentially the technology is there. I mean, we can deliver this information, as informative and as graphic friendly as we need to on a device right now, but it's how do we communicate that and how to make sure that both the patients and the providers and the caregivers are all on the same page in terms of how do they use those tools effectively.
Yeah, ultimately, this is where patient portals should be stepping into all this. I mean, we're putting these personalized, secure communication channels in place, but a lot of that patient education, again, depending vendor to vendor, but a lot of the patient education stuff that lives sort of on your consumer website, there's no easy way to sort of incorporate that into the conversation or to prescribe someone a class going on at the organization or, a lot of these other things that may be going on. So I'm sort of hoping that those things open up to the extent that at some point you can include some of those other sorts of things into the back and forth conversation that's going on there. But we're all putting the infrastructure in for that one-on-one digital communication channel to be in place. It's just a question of, can you really do more than send lab results to the patient with that?
Thank you very much, everyone.